many people have heard of the prevalence of heart disease in the Rio Grande Valley. Many people have heard of the prevalence of diabetes in the Rio Grande Valley, but there is another metabolic disorder that many people haven't heard of. I'm actually just learning about it now, and it greatly affects the Rio Grande Valley. It comes from the way that we eat, and many people may not know that they even have it. I am on the line with Dr. Rashmee Patil today. She is a hepatologist, liver specialist, and a clinical researcher, co-founder of the South Texas Research Institute here in the Rio Grande Valley. Dr. Rashmee Patil, welcome to the show.
Hi, thank you so much for having me. It's a pleasure to be here.
Thank you very much for taking the time to come on. Now, I was really shocked to learn about NAFLD at first, not only because of how prevalent it is in the Hispanic population, in the Rio Grande Valley population, but just the fact that people may have it for a long time and not even know it. You have been practicing as a liver specialist here for a long time. How much of this are you seeing in our community?
Well, I think you touch on a really important point. NAFLD, I'll kind of break it down for your audience, is NAFLD. It's an acronym, and it stands for non-alcoholic fatty liver disease. The non-alcohol related part, of course, meaning that as a physician, I say that this is fatty liver not related to alcohol. And the fatty liver disease, meaning that the liver has more than 5% fat.
Right.
I am a liver specialist, and I've been practicing here for the past couple of years, and in my experience, I think we're seeing a lot more non-alcoholic fatty liver disease in the patient population in the Rio Grande Valley than in other parts of the country.
Right. So it's happening here a lot more than anywhere else. And just like you mentioned, what we're talking specifically about is the collection of fat in the liver. And just to be clear again, people do not need to drink alcohol to get this. It comes from the way that we eat.
Correct. So alcohol-related liver disease is really defined pretty clearly. And for men, any man who drinks over 2 standard drinks a day or 14 drinks in a week may be considered to have alcohol-related liver disease. And when I say a standard drink, I have to also be very clear there, because a standard drink is 12 ounces of beer, 1.5 ounces of hard liquor, or 5 ounces of wine. And so for men, it's 2 standard drinks a day, and for women, 1 standard drink a day.
Right. So let's talk a little bit about how this disease progresses. I'm showing my audience here the way that a liver progresses through this condition. Now, at the very left, we have a healthy liver. What is going on with this liver that it moves into that first stage of NAFLD, non-alcoholic fatty liver disease?
Sure. So the normal liver is able to house some amount of fat and actually is very important in the process of fat metabolism. But once the liver houses more fat than normal, it starts to become stressed. And so the term NAFLD is an umbrella term under which sits several different phases of fatty liver disease. Some people may have simple fat in their liver, which actually never causes them any real problems. But others have a progressive form of fatty liver called NASH, or non-alcoholic steatohepatitis.
Got it.
It actually just means that when we do a biopsy of the liver, we may see fat with inflammation. And so as you see that spectrum of scarring in the liver going all the way from normal-looking liver all the way to a scarred and injured liver with cirrhosis, that scarring in the liver is really caused by the toxicity of fat. We call that lipotoxicity, which then causes a cascade of events that stresses the liver with inflammation and then the resulting putting down of scar tissue. So it's really a natural process. I mean, but once the liver becomes very stressed and overburdened by the scarring process, that's what leads to cirrhosis.
And very basic question, or basic on our end, not too sure how complex it gets on the other side, but what causes this to occur in the diet? I mean, are we talking about simple overeating, or is it eating certain things or other environmental factors? What pushes people through this process?
So the diagnosis of fatty liver is very closely linked to something called metabolic syndrome, which encompasses diseases such as obesity, diabetes, high blood pressure, and high cholesterol. So much of those factors actually stem from the diet, and the diet being a diet high in starch and high in carbohydrates. So those folks who are eating a lot of processed foods and a lot of carbohydrates are more prone to develop the metabolic syndrome and to develop insulin resistance, which is really one part of how NASH works. But what we also know is that NASH is a very complex disease. So some people may have, more of a problem with their bacteria in the gut and how it's communicating with the liver. So that's one way that fatty liver can be caused. Another way is that some people with fat develop inflammation more quickly than others. And then there is also a genetic component to the disease in which some people put down scar tissue more quickly when the liver is stressed compared to others. And we actually see in Hispanics that there is some genetic predisposition to that process.
Got it. So maybe because of that predisposition and because of its prevalence down here, I mean, when I heard about this, I know that I told my family about it. I know that I wanted them to get screened for this. How much do you recommend for just any normal person, any Hispanic living in the Rio Grande Valley whose diet may not be very good? How recommended is it that they just get this checked out to see maybe if this is affecting them?
So I think that's a nuanced question. I think that according to our guidelines in the different liver societies, the Liver Society in America and the Liver Society in Europe, there's not a recommendation to screen every single person who may have an unhealthy diet because it's not cost effective in the healthcare system in general. But what I recommend is that if you are obese, if you have diabetes, if you have high blood pressure, high cholesterol, any one of these risk factors of the metabolic syndrome, that you really are getting your liver checked with your primary care physician. Those folks who then have fatty liver or who definitely in terms of risk factors have diabetes should be seeing me, if possible, at South Texas Research Institute, or seeing anyone who can perform a fibroscan, because it's a sort of point of care test that we can do at the bedside.
Right, and I think fibroscan is the key word, and that's the kind of test that would tell you, and everything you're saying is on point because in my own family, I do have family members who know to get, for example, their sugar levels checked. They know, for example, to get their cholesterol levels checked. And even though they may be, along this path of metabolic syndrome, I don't think maybe even their primary care providers have gone out of their way to mention, hey, you might want to check your liver out, get a fibroscan, even though some of the other markers may be wildly off, and they may be, as you mentioned, in this category. One of the reasons I wanted to have you on the show today is because South Texas Research Institute, that you co-founded, is actually offering a free fibroscan. Is that correct?
That is correct. We are offering free fibroscans currently.
So tell us a little bit about how it works. Is it invasive? What's the actual process when people go in to get tested with this? What can they expect?
So the fibroscan is a newer imaging technique that we use in the field of liver disease, and it's a completely non-invasive procedure. It's really similar to an ultrasound. If any of your listeners have ever had one, we use a probe very similar to that exam. And essentially what happens is you lie flat on the exam table. All you have to do is be fasting for 3 hours. One of our techs or our nurse practitioner or our coordinator will perform the exam, and it takes less than 10 minutes. essentially what happens is a pulsation is sent through the liver. You feel kind of a thump on your abdomen.
Got it.
And we're able to capture about 10 good pictures of your liver to look at fat content and stiffness of the liver. So it allows us to say, do you have fatty liver? And if you do, is there some evidence that there might be scarring without having to do a biopsy?
Got it. So very quick test, non-invasive. It's just an imaging test. Like you said, it's very similar to, did you say sonogram?
Yes, an ultrasound. Yeah,
an ultrasound, very similar to an ultrasound. Now, another thing that you do at this research institute is offer clinical trials of treatment in case something is found.
Yes, that is a big part of what we're doing. We're really focused on identifying liver disease in folks who live in the Rio Grande Valley, but we're also looking to offer some sort of treatment, because as of today, in 2020, we still have 0 approved medications for the treatment of NASH. And it is such a huge tsunami that is about to hit our healthcare system. About 30% of the U.S. population is affected by fatty liver, and about 8 to 12% have NASH. So when you think about the millions of people living in the U.S., 8 to 12% of them having NASH, that's millions of people. And so we still don't have approved therapy. What we do at South Texas Research Institute is we're involved in several clinical trials which look at drugs that are in development for the treatment of NASH and for the improvement overall in scarring in the liver. And, we have several options for patients. We take it individual by individual to tailor a program for them, but it's something that is very important, to be able to move medicine forward.
Got it. So for those people who may go in, have a fibroscan, see that they are in one of these levels of progression with this disease, the Research Institute can then bring them into a clinical trial where they might find treatment to reverse that. Is that, I guess, what point are you trying to get to with the clinical trials? Is this something that can be cured or treated?
So every clinical trial has a defined endpoint. So we're trying to reach efficacy in the drug in order to move the drug forward and allow it to affect more people, right? So every medication that you take has gone through a clinical trial process to ultimately be approved by a regulatory agency called the FDA, or the Food and Drug Administration. So clinical trials are there to not only help reverse disease, and that's in NASH, we look at 2 main endpoints. One is improvement in NASH by biopsy, and 2 is no worsening of disease in terms of scarring. So we want a patient with NASH to have improvement on biopsy and to even have some improvement in terms of scarring. So if you ask, is this curable? It absolutely is curable. I think along with diet and exercise and some amount of weight loss, a good therapeutic is going to be life-changing for lots of patients.
Very good. And another good reason to go in and get one of these fibro scans for anybody who is in that category of metabolic syndrome. Now, something I wanted to ask you, I was very curious about. We see liver detox product being marketed everywhere. I see them on the internet, television, and they talk about curing the liver, protecting the liver. Do these products really work? Are they something that can either prevent this or cure it or do some reversal on NAFLD?
That's a really good question, and it's a question that I get almost every day in clinic with my patients. But the short answer is no. None of these liver detox products are approved by the FDA, and in fact, several of them haven't been studied, and I can guarantee you that at least once a month I see a patient who's bought a product from online who comes into my clinic completely yellow or jaundiced, and that's as a result of these medications actually being harmful to the liver. So the liver is a a filtration system, and it basically is exposed to any medication that you take in by mouth. So you've got to be really cautious that you can develop drug-induced liver injury or medication-induced liver injury by some of these products.
So these products could make actually the situation worse in some cases.
Absolutely. I've seen it. I've seen it with my own eyes.
Got it. So again, another fantastic reason to fibroscan. Other than that, I mean, what are some of the things that we can be doing on our own, outside of the clinical trials, outside of the medication? I know you mentioned diet was one important thing. What can we do? What's the best thing we can do to keep our livers as healthy as possible?
So the best thing that you can do is to generally be healthy overall, because fatty liver is sort of a warning sign that there's other things going on in the body. So if you don't have diabetes, you may have insulin resistance. If you don't yet have heart disease, you're at higher risk of developing heart disease. So the thing that is most important is to maintain a healthy weight, a normal body mass index, to modify your diet to be lower in processed flour and carbohydrates, to be active, to be exercising at least 30 minutes a day, 5 days a week at a minimum, and to make sure that you're just getting your liver checked once a year. So I would say getting liver tests done through blood work, and if you're interested in getting a fibroscan, if you have risk factors, I think that would be the best way to keep your liver healthy. Obviously, I'm a liver doctor, so I also don't recommend excessive alcohol use.
Right.
But in general, in moderation, alcohol is okay for those without liver disease.
Fantastic. And fantastic free resource for everybody in the Rio Grande Valley who may be having these metabolic difficulties. You can get a free fibroscan for liver health check at South Texas Research Institute. Dr. Rashmee Patil, thank you very much for your time today.
Thank you so much for having me. I appreciate it.
Have a great day. Thank you.